Dr. Kevin Kavanagh, retired physician, also founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you today, sir?
Doing very well.
Your recovery from your cancer surgery has been amazing.
Well, I'm still kind of struggling a little bit at home, but I am doing better. But it set me back, I would say, at least 2 months. It was a pretty big surgery to go through, so I'm doing well. But that does, I think, really illustrate that even though we're in a pandemic, you still need to get medical care, because this was diagnosed during the pandemic, it was treated during the pandemic, and although I was very scared of getting COVID in the hospital, I got vaccinated, took precautions, and was able to get through this. And I'm very thankful I had this done, as opposed to being afraid, staying at home, and not going in and getting medical care.
Well, here's my first question for you today. The head of the Centers for Disease Control and Prevention, CDC, has a stark warning for states ditching indoor mask requirements, and that is, don't do it yet. Rochelle Walensky said yesterday, our hospitalizations are still high, our death rates are still high, we are not there yet. Her comments come as a growing number of states like California and New York announced their plans this week to drop indoor mask mandates. Walensky noted that although the numbers are trending downward, CDC data shows 99% of U.S. counties continue to have high levels of coronavirus transmissions. Are you nervous that these cases could spike again if the mask mandates are dropped, or is it just time to be done with them? What do you say?
Well, no, I think it's like being on an airplane. You don't really have that sigh of relief until the wheels are on the ground. And we're not there yet. We're coming in for a fast landing, hopefully not a hard one, but that's good. Cases are going down. But, let's not reverse the trend by not wearing masks. Now, whether or not it's a mandate, that's a political issue. When you hear a mandate being lifted, the important thing there is people are going to stop wearing masks. And we don't want that to happen. So this is a little bit too early to do that. Omicron is a dangerous virus. I mean, Jack, we've had more deaths per day with Omicron than we've had in the last year. Much worse than during the Delta peak. And this is on nationally as a whole. UK is still packed with cases. So we're not nearly to the point where we want to really let up. And of course, you have the stealth Omicron variant, which has a lot more mutations, and we're really not sure what's going to happen with that. Both people with vaccines and people who've had prior infections are getting infected with Omicron. The disease, luckily, may not be as severe, but I say may because it can be, especially in the elderly and immunosuppressed. But everybody takes a risk if you get infected. So you want to really maintain following public health advice and get vaccinated if you haven't been. That includes if you've had a previous infection. And if you've had a 2-dose vaccine, you need to get boosted. Remember the debate of natural immunity versus vaccine immunity. That's looking at a 2-dose vaccine and natural immunity with previous variants. We're now in a whole new ball game. If you've had a vaccine and it's been greater than 5 months, you need to get boosted. If you've had a Johnson & Johnson vaccine, you need to be boosted. And if you've had a previous infection, view the vaccine as a booster. We need to keep our immunity rate as high as we can so that we can avoid these infections. Now, the good news is there's one monoclonal antibody that I think is fantastic, the GSK. This is kind of made on the same strategy as the Army vaccine. It should work on even additional variants. And we've got 2 research areas that are looking at getting a vaccine that is going to work on all of these type of coronaviruses. At least that's what they're hoping. So we've got some new technological breakthroughs. There's some light at the end of the tunnel. But until we get cases down, until we get the therapeutics out there so that they're widely available, let's continue to be cautious with our living and let's follow public health advice, which means social distancing and wearing a mask.
What of the Army vaccine you made reference to?
Well, the Army vaccine is one which is looking at the particular part of the virus which is in common with most, if not all, of the coronaviruses that are the SARS lineage. And it will work on SARS-1. That's the 2003 virus, which is very lethal, but luckily doesn't spread much. And that was in 2003 was the epidemic from that virus. So it works on both that virus and our current SARS-CoV-2 virus, and they feel it's going to work on the different variants. The GSK monoclonal antibody, that's the one that's in short supply and the only one, unfortunately, that works with SARS-CoV-2 right now with Omicron. That monoclonal antibody also has the same strategy. It's the antibody to that particular part of the virus that works on SARS-CoV-1 and SARS-CoV-2. So in other words, it may be the part of that spike protein that if it changes, it can't attach to the ACE2 receptor. So that's what they're hoping. And I really think these new products coming down the line, this new vaccine, which is out there and hopefully the future, hopefully will be available by end of the year. I think all of that is very encouraging. And of course, you have an mRNA vaccine that's going to be coming out hopefully by the summer that's going to be Omicron specific, and that will give you additional immunity. So there's definitely light at the end of the tunnel, but right now it's not time to give up on following public health advice.
All right, we've got a whole host of texts here. Let's see, hasn't it been proven that nothing but the N95 masks even work?
Well, that's kind of all or none thinking. The cloth mask will give a little bit of protection with Omicron, but certainly it's not what I'm going to be wearing. I am going to be wearing an N95, and I think that's what the messaging should be. They're readily available. So when people say, masks don't work, they're talking about cloth masks. If you want to go that route, fine, but wear an N95. If you're at a rally that's screaming that, but no one's wearing N95s, that's crazy. And even in an outdoor setting, you have to be careful. If you're close to someone, you will still get droplet spread.
Wally says, Fox reports Science magazine reports 80% infected will have heart issues in a post-COVID study. Up to 80%, that should read, up to 80%. You know about that?
Well, I don't know about that particular one, but these are coming out right and left showing that long COVID is a problem, both not only with the lungs, but you've got memory problems, fatigue, kidney injuries, cardiac problems. It will depend upon the group that they're looking at, if you're over age 65 or if they're looking at everybody or just people in the ICU or hospitalized. So I think it's not going to be everybody who has a positive COVID test is going to have heart problems, but certainly you can look at high risk categories such as those in the ICU that'll be that high. And certainly, even if you're young and you had a mild case, you're still at risk for heart problems. And that's why we keep harping that just looking at fatality of this virus isn't what we need to be doing. We need to be trying to prevent all infections because that's the safest we can do to maintain public health, to maintain our health of our frontline workers, and to make sure the United States is strong and competitive with the world.
All right, let's go to the Brian. Good morning, Brian. Thanks for holding.
Good morning. Earlier in the week, the doctor said he was supposed to research the use of the ivermectin in Japan. I'd like to know his findings.
Yeah.
I'll get off here so I can hear his response.
Yeah, he actually reported on that on Monday, but we'll let him do it again. Thank you. Yeah, what did you find out?
Reuters misquoted the release. It was not effective, but had an effect. And of course, you only research drugs which have an effect. Ivermectin's being researched at Vanderbilt, but only, I would say, about 1 in 100 drugs that you think are going to be effective on the front end. In other words, they have some effect. You're not sure if it's going to be safe or enough to work, wind up entering into clinical use. So this is still something that's being researched. I have not heard any ground-shaking, advice coming out or advisements from Vanderbilt or other research areas saying that, hey, this is the next panacea. Overall, the chances are that it's not going to be effective because that's what the chances are of drugs that are being researched.
We're back with Dr. Kevin Kavanagh, and this is a really good question that I think you should answer, and I think you should have the opportunity to answer this. And I really do think it's a good question. I think you'll agree with me. Since I'd like to ask Dr. K, it appears from your comments that you're focused on a zero-sum game. In effect, it sounds like you're saying that until there are zero cases, mandates should remain in place. Why is that?
Well, first of all, zero-sum game means that if you switch strategies, the end result is the same. So what you're talking about is no COVID cases, and that's not the case. You need to decrease the level of cases. We cannot maintain a plateau of where we're at now with the healthcare stressed out, our hospital systems not able to deliver effective care to people who have non-COVID illnesses, to frontline workers that are also stressed, where we have teacher shortages. So the idea is to lower the rates at this point to a level that our society is going to be able to function. And we're not there yet. And to prolong you getting the illness until these antivirals and the new vaccines are out. Now, you're not going to get to a zero COVID type of a situation because this disease is already in animals. It's, for example, in white-tailed deer. They just picked up now Omicron in Staten Island deer. Before that, we talked about how 80% of the deer in Iowa are testing positive. We've had tests of positivity in deer, and I believe it's 40% of the samples that were out of Michigan, Illinois, Pennsylvania, and New York. So all of this means this disease is here to stay. And I should add, these deer are not picking up this disease inside Walmart. They are spreading it outside, which is why I said, even if you're outside, if you're within 6 feet of a person, you can still get droplet spread. You still need to take some precautions. So this idea of, if we can't get rid of it, then we don't need to do anything. That's not how you live with this virus. We need to get it to a level that society can function.
Let me ask you this. At what point would you say, okay, let's relax? First of all, if you weren't listening at the beginning of his program, you said mandate is a political term, and you're saying, let's don't talk about mandates, let's talk about wearing masks. Even if there's a mandate or if there's not a mandate, you're saying people should still be wearing the mask, right? I mean, am I correct in that?
That's correct. And
because I think the mandate just puts people off. So let's say you're saying, mandate or not, people still need to be taking precautions. They need to get vaccinated. They need to wear the mask. At what point, I think is what people want to know, are you going to say, okay, it's now you can stop wearing the mask? At what point in this country would you feel safe in saying that?
Well, originally, Jack, the bar was at a positivity rate of around 5% or below. And I think we still need to be looking at that. But also people need to realize everybody's going to be a little bit different here. First of all, we need to watch out for the 2.7% of our citizens, or about 1 in 30, that are immunosuppressed. But if you're healthy, you may want to relax and take other risks than old codgers like myself that are very high risk. So it's not a simple line. And then you keep getting different variants with different propensities to spread. In some Southeast Asian countries, people wear masks all the time as a courtesy to others, even when you're not having a pandemic. But certainly when you've got peaks of Omicron that are rolling across the nation, and you've got a positivity rate of still over 20% in the state, now's not the time to let up.
I totally agree with you, and I appreciate your frankness about it. Hey, we will talk to you Monday. Have a good weekend.
Thank you, sir.